Hello again, this is Dr. Hufstader, and I wanted to take this time today to talk to you a little bit about calcium, because you and probably everyone you know has or is at this point taking some sort of calcium supplement. And it's one of the things that almost every woman over the age of 40 is thinking that they ought to be taking if they're not taking it already. And calcium supplementation is almost ubiquitous. They sell it by the truckload, calcium. So I thought I'd give it some time and make sure that we're all on the right page as far as what we understand about calcium. Calcium is certainly the most prevalent mineral in your body. There's more calcium in your body than all the other minerals combined. And about 98 to 99% of it is locked up in bone and teeth. And the other 1% of calcium in your body is everywhere else, in the blood, in the soft tissues, etc. Now, when people supplement with calcium, the most common form of calcium, and you probably know calcium supplementation comes in many forms. You can find calcium citrate, and you can find calcium carbonate, and all sorts of other types of calcium. But the vast majority of it is in the form of calcium carbonate. When you're supplementing with calcium, what you want to do is use a form of calcium that is easily ionized. And when I mean ionized, what I mean by ionized is that when the calcium enters your body, it can quickly be dissociated. The calcium ions can move away from whatever other molecule they've been bound with in order to make it stable enough to put it into a tablet. There are almost every source of calcium can eventually be ionized in your body, but for practical purposes, there are really only three sources of ionizable calcium that you get in your diet. And those are calcium lactate, calcium citrate, and calcium malate. Calcium lactate is the type of calcium that is inside cheese and dairy and things like that. Calcium citrate is what is usually the type of calcium that you find in plants, vegetables, and so forth. And then, except for calcium malate, malate is found in apples, maple syrup. It's a pretty good source of calcium malate. But the easiest source of calcium for you to ionize is calcium lactate. Calcium lactate in the blood has one enzyme reaction that occurs to take calcium lactate into a form of calcium called calcium bicarbonate. Calcium bicarbonate ionizes immediately in the blood. And calcium lactate is the source of calcium. If you're going to supplement with calcium, it's the source of calcium that is the very best for most people. Now, there's a lot more to this story about calcium than what I'm telling you right now, because calcium is most people are concerned about calcium for the health of their bones and their teeth, but really we should be more concerned about calcium for nerve conduction and muscle contraction and blood clotting, cancer fighting, immune system support. All these activities are calcium dependent. And when people become ill in this practice, it is just a given that if a patient comes in here with the flu or with a cold or with any kind of fever, an illness that's associated with a fever, that calcium deficiency is without a doubt a part of that, and we load them up with calcium quite liberally and get good results with that. But it has to be an ionizable source of calcium, and calcium lactate is the very best. I wanted to talk to you also about this business about the calcium-magnesium ratio. You probably know, if you shop for calcium supplements inside health food stores, that you find them often combined with magnesium in a ratio. There's 2-to-1 ratio, 2 parts calcium, 1 part magnesium, or a 1-to-1 ratio. Both of these ratios are way, way too low. The calcium-magnesium, the ideal calcium-magnesium ratio in the body is 5-to-1. 5 parts calcium, 1 part magnesium. So unless you can find, and there are a couple brands that I'm aware of that do have that 5-to-1 ratio. But if you don't, if you're supplementing with calcium and you want to ensure that you get the right calcium-magnesium ratio, which is important, and inside food, there are sources of calcium, we find this ratio too. So it's important to keep it, making sense and having something to do with what you'd actually encounter in food related to nutrition. You may have to buy the calcium and magnesium separately and just take 5 times as much calcium as you do magnesium. So, if you're taking calcium carbonate, by the way, which, like I said, is the most prevalent source and the cheapest source, I'm here to tell you that is not a source of calcium to be eating. It has nothing to do with nutrition, and is not something that God ever intended for you to eat. Calcium carbonate is limestone, chalk, oyster shells. It makes a pretty decent doorstop or a paperweight, but I wouldn't eat it, and neither should you. But at any rate, if you have any questions of me, please email me. You can get my email address or just send an email to our webpage, lifetimewellnessclinic.com or drhufstader.com, and I'd be happy to be of help to you. I truly appreciate you, and have a good day. Bye.